Now I would like to introduce our presenters. So we have three of some of my favorite humans with us here today. We have Dr. Teresa Anderson, who is a psychiatrist and the founder of the Anderson Clinic, which is really committed to making cutting-edge treatments available to our local community. And actually, people even travel to see Dr. Anderson. Their clinic specializes in ketamine infusions and PRTMS, both really neat treatments that are not easy to get a hold of and are highly effective. So she'll be telling us more about ketamine here in a moment. And then we've also got two of our psychologists from Hello Mental Health, Dr. Rachel Thompson. She is an expert in evidence-based care. She is highly committed to providing the highest care to patients that come into our clinic. And prior to coming to us, she had experience in the VA and in the state psychiatric hospital. So she has worked in a variety of settings with a variety of different people and is just really excellent at what she does. So she's been part of our team that's been providing the ketamine integration sessions, along with Dr. Helmer Figueiredo, who is the person with the most doctorates that you'll probably ever meet in your life. So I have never met a more educated person than Helmer, but for the sake of this presentation, we'll stick with the ones that are relevant today. So in addition to being a clinical psychologist, he was also a highly published neuroscientist. And his understanding of ketamine has been fantastic for our team because he understands it from a scientific and brain-based level. And so he helps kind of translate the medical piece to those of us who are doing the therapy. And so for the past year and some months, we've been partnering with the Anderson Clinic to make ketamine treatment available to individuals with mental health conditions and to do therapy integration sessions shortly after, which really maximizes the effect of this treatment. So what I'd like to do is turn the stage over first to Dr. Anderson so that she can tell us more about ketamine, and then Drs. Thompson and Figueiredo will explain how the integration sessions come into play and some of the experiences we've had over the course of the past year. So, Dr. Anderson.
Thank you so much, Dr. Brian. By the way, one of my favorite people in the whole wide world. So thanks for inviting me. I'm happy to be here. So I'm owner operator of the Anderson Clinic in Cincinnati, Ohio. We have been offering ketamine infusions for the past 7 years. We're the first in the state of Ohio to offer them. And we have seen over 700 patients through this modality. We also offer psychotherapy, medication management, and PRTMS. But for ketamine, purpose of ketamine in this talk today, we've had really, really, really good results in terms of outcomes. We see folks who have tried traditional therapies and traditional therapies have failed them, folks who have done talk therapy, folks who've done multiple rounds of various and sundry medications and combinations come to us for treatment-resistant depression, anxiety, and PTSD. And it has been just an amazing run for us. We see close to 70 to 80% efficacy in terms of symptomatic reduction. And it has been really, really well tolerated. I'm hearing something in the background, Bailey.
Oh, shoot. Sorry, if anybody who is not presenting has their microphone off, if you could please turn it on mute. I think we might have that sorted. Is that okay now?
Yes, that went away now. Thank you. I appreciate it.
Yeah.
So in terms of safety profile, ketamine is really well tolerated. I know it has a bad rap in terms of being a street drug and widely available for recreational use, but the dosages that we use it at are very, very safe. Just for instance, if you broke your arm in a motor vehicle accident and went to the emergency room, you'd be getting 2 to 4 times the dose of what you'd receive for a mental health treatment, just in terms of anesthetic doses. So while it is an anesthetic, it is not being used at anesthetic doses. So we use 0.5 to 1 milligram per kilo of body weight, and that's in the safe realm for outpatient use. For the most part, people experience like a mild dissociation at worst case. Best case scenario is just they feel really relaxed and want to take a nap or just feel really at peace. For some folks, though, especially those who've experienced a lot of trauma in their lives, it can bring up a lot of things really quickly. You've heard the old adage in vino veritas, in wine truth. It can dissolve a lot of the defenses that you've been sort of holding back. And one of the primary factors in PTSD, especially, is avoidance. And so if you've been working really hard to not think about some of the scary things that have happened, it can bring a lot up, which is why ketamine assisted psychotherapy in between the infusion visits are so worthwhile and so useful to unpack everything that's happened during the infusions. Dr. Bryant, did you have any other questions for me in that regard?
I have so many questions. So one of the things that we hear a lot is people having concerns about ketamine safety. They hear stories about people going into K-holes. So can you talk to us a little bit about who ketamine is good for? If it goes wrong, how does it go wrong? Should people be a little nervous?
Mhm. So the only time that I would be concerned is if a person had a baseline psychotic disorder, like schizoaffective, schizophrenia, bipolar mania with psychotic features, bipolar depression with psychotic features. If that psychosis isn't under good control, a person could conceivably hallucinate during the treatment. And for us, out of 700 plus patients, that's happened 3 times, 2 of which the people were not aware of having had a psychotic issue before because they were recently diagnosed with depression, for instance. And the third was a medical issue that was completely unrelated. So 3 out of 700 plus patients, each of whom have received over 6 infusions, it's not a bad percentage. So it's really well tolerated. We've had 18-year-olds, we've had 84-year-olds, we've had little old ladies with gallon bags of medications with them. And so again, it's really well tolerated. The side effect profile is very minimal. About 30% of our folks experience mild headache or mild nausea, and about 1% of our folks experience a spike in their blood pressure. And again, you're more at risk if you already have uncontrolled hypertension, high blood pressure. But those are all things that we can treat in-house. And so it's generally really, really well tolerated. Going down the K-hole, there are a couple things that they're an issue with that. One is you're receiving a medication or drug that's off the street. You obviously don't know what the dosage is. You don't know what it's cut with. You don't know anything of what you're receiving. And the other thing is it's a matter of all at once. And so our infusions last between 45 minutes to an hour versus like in the emergency room where you get a bolus and you're injected and your brain is off in Mars somewhere and your body is still down here. You're not feeling anything, you're not seeing anything, you're not hearing anything, you don't remember anything. And so again, our objective isn't to get you high. Our objective isn't to use the medication at an anesthetic dose. Our objective is to just calm the nervous system down enough to where things can flow more easily and they can be more easily talked about. They can be more easily dealt with.
Okay.
Folks who are good for this particular treatment-resistant depression, anxiety, PTSD. Some OCD folks, we've had more of a 50-50 turnout for the OCD folks in terms of symptomatic reduction, but it's very hard to treat with any modality. And the only major contraindication outside of the hallucinations is if you're on big whopping doses of opioids or narcotics. Not that it's going to hurt you, but it's going to directly counteract the ketamine because the opioids, benzodiazepines, alcohol are all central nervous system depressants, and we're trying to do the opposite.
Okay. So do people need to get off their medications before
Not
ketamine?
not necessarily. We just warn them in advance that the ketamine could have a decreased efficacy and or we might have to bump the dose within that safe little window that we can operate safely on an outpatient basis.
Mm-hmm. So ketamine's gotten kind of popular in the news lately, and you hear about all kinds of different options. There's nasal sprays, there's intramuscular injections, there's oral ketamine that you can get through the mail. So can you help us understand the differences between those and why would somebody want an infusion?
Sure. So the oral ketamine is obviously the most easily obtainable, but I think is by far the most dangerous for a couple of reasons. One is not medically monitored. I mean, you're seen by Zoom by maybe a nurse practitioner or mid-level provider. And if something medically goes wrong, you can't really do anything about it. The other thing is that they tell you to put the lozenge under your tongue for X amount of time and they tell you to take it out, who's to say if you will or won't? I mean, not that we shouldn't trust our patients, but at the same time, I mean, it's a safety issue, right? So that's one issue. The second issue is that if you aren't also undergoing therapy while receiving this treatment, it's sort of like putting a Band-Aid on a large flesh wound. It's not really gonna help in the long term. And the third issue, which is probably the biggest, is a biochemistry issue. So we only offer IV ketamine infusions intravenous because we know exactly how it's metabolized once we put it into your body. We know based off of your lean body weight what it's going to do and when in your system. The fact that 100% of what we give you is going to your brain for good usage. It's called bioavailability. And so that means the percentage of what we're giving you is what your body is using. And so 100% of IV ketamine is bioavailable. When you use it intranasally, for instance, it automatically goes down to 60 to 70% bioavailability. So automatically they have to 1.5 times the dose to get the same effect. So what happens when you increase the dose? You increase side effect risk profile, you increase the risk of dependency, and just by mere fact of the mechanism of action itself, what if your nasal septum is thicker than mine? What if you have allergies like everybody and their brother in the state of Ohio? What if you have a cold that day, or you didn't inhale, or part of it went down your throat and you swallowed it instead of inhaled it? I mean, there's so many factors. What if the thing misfires? So with IV, you know if it's in the vein or not. With IV, you know that you're getting 100% of it. You know how it's metabolized. There isn't any question. And so all those other methods we feel are inferior because of the bioavailability, and it increases the risk factor tremendously.
So who do you think it would be worth it for to not go the route of your traditional meds, but to actually invest in a treatment like this? Because it's more aggressive, it's more costly. So why do something like this?
That's a great question. So folks who have metabolic syndrome or problems with weight gain or sexual side effects with medications, as many people do have, this is a great option for them. Folks who don't want to be on a daily medication for the rest of their life, a great option for them. Folks who have other medication issues, like they already take a tremendous number of medications and have so many contraindications and side effects, if they would introduce something like an antipsychotic or a mood stabilizer or that sort of thing, that would be a good option for them as well. And also folks who may be in the near future planning to become pregnant. You could try to use a ketamine, get your mood boosted, that sort of thing, and not be on something while they're conceiving, so to speak. That would be a good option. And, there are always going to be people who are interested in more alternative forms of medicine instead of your regular medicine and that sort of thing. But it's not that we're anti-regular medications. We use them all the time. But it's nice to have another tool in the tool belt because, sometimes medications don't work for people. You also have, there are some people who have deletions in the L-methylfolate transporter gene. And so for those folks, nothing serotonergic based is probably going to work for them anyway. And so that's also something that I thought of that would be useful for these folks because it works in a completely different method of action.
So for those for those people who are watching this and thinking about either maybe they're interested in this for themselves or for a family member or for a patient, can you help give us a sense of what happens after people call and schedule with you from the moment they walk in the door?
Absolutely. Absolutely. So they could call our ketamine scheduling line, which is 513-802-9944, and they'll get you set up with a time frame. So you'll come and visit with us. You'll do some intake forms in the waiting room. We'll get a urine drug screen and pregnancy test if you're female. You'll speak with me and my nurse practitioner, who's my director of clinical operations in the back. And we'll do a full medical history in terms of what medications you tried before, what medications you're currently on, what medical history that you have that, might prove difficult in terms of ketamine infusions, and what you're hoping to get out of the infusions. Because part of this is, your expectations. Some people come in here as sort of a last ditch effort because they feel like everything else has failed them. Some people come in and say, you know what, I'm on medications and it's okay, but I'm just functioning. I'm just at bare bones basics, kind of floating by, and they want to see an improvement in joy in their lives and that sort of thing. And so expectations are important. And I also want to reiterate to folks that this is, not a magic wand by any stretch of the imagination, but another tool in our tool belt. And so I want people to understand that it's not going to poof, make every symptom go away, or poof, completely reduce the need for any medication ever at any time. But right now, it can kind of help pull you out of the abyss long enough to see the things that you need to do and start functioning the way you need to function. And those behaviors can then reinforce the positive neurochemistry. So you'll sit down and chat with me and Brent, and then we'll get a weight on you. We'll make you comfortable in one of the 4 infusion rooms that we have. They're all private. If you want your friend or family member, spouse or loved one to come with you, we welcome that. We want to make sure that it's a comfortable environment for you. Our only request of your comfort person is that they don't initiate conversation with you. Now, if you turn into Chatty Cathy while you're under the influence, feel free, but we suggest that the person who's there with you to provide comfort be there for you if you should need them. If they initiate conversation, sometimes the person is sort of like drawn back into the present moment, and we really need our brain to just go wherever it's going to go and lower their defenses and be able to just float off into space, and whatever they need to have happen to sort of reintegrate some of those memories and trauma and feelings, that needs to happen sort of in a self-preserved space. And so we frequently recommend folks to use like an eye mask, or listen to tunes. Anything without words is useful, or if you know it well enough where it's in the background and the words aren't going to bring you back into the present reality. They actually have ketamine playlists on Spotify now, which is wild to me, but it's sort of like ethereal or more jazzy stuff. Anything that puts you in a relaxing mood. And so we get the IV started. We take baseline vitals. We'll check vitals throughout the infusion just to make sure that there isn't too high of a spike of blood pressure, if there is one at all. Again, if somebody gets sick to their stomach or headache, we can treat in-house. And a lot of times it's just a matter of slowing down the infusion. It doesn't change how well the infusion works for them. It just changes how they experience the side effects. And so after about 45 minutes to an hour and the infusion's over, we take down the IV. We get them a drink, a snack, make sure that their tummy is okay, escort them to the bathroom if they need to, and just kind of get their sea legs about them for 15, 20 minutes until they're able to walk out on their own. They have to have a driver. If they're from out of town, it's okay to use Uber or Lyft, but we need to make sure that that's taken care of before you start the ketamine infusion, just for safety's sake. We recommend for the rest of the day that they kind of lay low, Netflix and DoorDash kind of day. It's, they don't have to make any major decisions, that they just be at peace and relax and not, try to do anything or accomplish anything or be productive or go back to work or anything. The next day they're okay to drive, but that day, no driving, no operating heavy machinery, no making major legal medical decisions, just being. It's really good if they can journal about their experiences when they come to a little bit. Obviously, if they have a therapist, we tell them, highly recommend to follow up with their therapist. And if they don't have a therapist, then we send them to you guys for the hopes of doing ketamine integration sessions, because we've seen the absolute best results when people pair those two things together. Because especially in PTSD, I harp on it because so many things come out that your initial defense mechanism is to want to stuff them back in and not deal with them again. And every time it feels like you're opening Pandora's box again. And so to have someone to safely guide you through that process and to be able to help you unpack what's happening and to not put it away, but actually to deal with it, is so important in terms of forward momentum and healing.
So I'm going to tee this one up for you before we have Doctors Thompson and Figueiredo join. Have you found it effective to have the therapists at Hello Mental Health available for your ketamine infusion patients?
Oh my gosh, it has made the world of difference, because so many times, if I just give, a colleague or a friend that I know, and I say, well, here, you can call these people, you can call these people, availability 3 to 6 months out, but I kind of need somebody right now, right? And so to know that you guys have a couple days set aside just for our folks has been such a comfort, both to us and our patients too, because I know, oh, well, I can actually get in if I call like this week and my infusions are this week. I'm like, yes, you can. So that's, yeah, it's been an incredible comfort, and people have been so surprised and sweetly impressed by that.
Well, wonderful. So I would love to invite Doctors Thompson and Figueiredo to join us. So we can hear more about your experience doing the ketamine integration sessions, and helping those of us who have never heard of it before to understand what is this and how does it work?
Okay, first of all, I want to thank you, all of you participants, for coming to this event on ketamine, assisted psychotherapy. I also want to thank the psychiatrist and colleague, Dr. Teresa Anderson for her wonderful presentation on the ketamine pharmacological treatment. And finally, I want to thank my colleagues at Hello Mental Health for putting this amazing webinar together, including Dr. Bailey Bryan, Dr. Rachel Thompson, our wonderful assistant, Andrea, and Zach. I'm still working the pronunciation of your last name, Andrea. So thank you so much. Do you have a first question for me, Dr. Bailey?
Yeah, so if you could start off by just telling us a little bit about what is an integration session and what happens during one.
Okay, I will begin with integration, and I want to apologize beforehand for going to the very basic meaning of the word integration. But this is going to help us to get a better understanding of what it means for psychotherapy with ketamine. Integration is the act of or process of combining two or more things into a single unit that will function effectively. Okay, so in other words, integration means to put together, to mix, to combine, to connect, leading to assimilation, synthesis, completion. This way, integration occurs when separate people, things, processes, or experiences are brought together as a unit to achieve the desired functionality and performance, so put them together. One important thing to remember here, and I'm talking in very general ways, is that the principle that when you combine two or more things together, this combination is going to result in an integrated whole. And in this whole now new unit, the functioning of this unit is going to be a lot more than a summation of the individual parts. To give you an example, when you combine atoms to make like a molecule, the resulting molecule, the properties of the molecule is going to be entirely new property that is just going to be more than the sum of the properties of each isolated atoms. In the nervous system, when you combine cells to, let's say, make a circuit, let's say in the amygdala, the functioning of that circuit, in this case, the amygdala, is going to be a lot more than just the functioning of each individual cell that make the system. Now, going back, what does integration really means in terms of psychedelics? What are we really putting together? When individuals use a psychedelic substance, they will undergo what is called a psychedelic experience. The psychedelic experience, is known for many, many years, and it refers to a profound altered state of consciousness that is induced by administration of the psychedelic substance, in this case, the ketamine, during the infusion. So during this psychedelic experience, the individuals will undergo many, many significant shifts in perceptions, cognitions, emotions, sensory experiences. I'm always amazed when I hear what they go through in those experiences. Their whole being, their whole consciousness is going to definitely be altered, and this is the intention of any psychedelic drug. These alterations can also include visual hallucinations, changes in perception of time, space, synesthesia, feeling of connection, of being unit with the universe, with others, and here there's profound insights into one self or the nature of reality. This is a fact known to anyone who used any psychedelic substance, okay? However, there is something very, very important about this. All these experiences are going to occur in the infusion room. In this case here, like in Dr. Anderson's clinic, the individual is going to be having all these experiences. And during the infusion, when the individual is being administered the ketamine. Now, when they have those experiences, if left that way, it can be really an isolated experience. They may leave that room at the end, the facility, and they go on with their lives. They may have some memories, some remembrances, and they will at some point wonder what these experiences means. So the individual may leave the session with very, very rich insights that could be put together that could bring a whole different meaning into their lives. So this is when the work of the therapist comes here. What do we really do? What are those isolated parts? One is the experience that happen in the room. Two is the experience that will happen in their life outside of the room. And the therapist is a catalyst that is going to bring together, is going to help them to put together and call attention to insights, to call attention to memories, or to situations that happened in that room. And the individual by themselves, most of the time, they won't be able to do it because of some of these experiences. It's like when you're like driving that you cannot see, you have a blind spot, and the therapist will be able to see. It happens to me very frequently when I'm doing a psychotherapy for individuals that went through ketamine, infusion the day before. So the psychedelic integration psychotherapy is just this, putting together to combine the psychoactive experience that happens in the room with their life, with the meaning that they want to give to their life. And meaning here will become very, very important because those are the two things that are integrating. So integration is taking the psychedelic experience with the individual's own experience. Those are very abstract things that I mentioned. And as we move along, it's going to become more and more clear about what is really happening here. We have another question, Dr. Brian?
Yeah, so would you be able to give us a really de-identified little story of maybe something that's happened in an integration session, maybe the type of content that you worked on or how somebody's found that helpful after they've had an infusion?
Yes, yes. But I'll begin by saying that, as I mentioned before, integration is putting those experiences together, is that the individual is going to go through a lot of emotions. They may not have any emotions, but they have visions to all these experiences. And we are going to be putting together with what is happening outside of the room. For example, I had a patient who had a very, very difficult relationship with her father. And unfortunately, her father passed away. And her relationship with the father impacted her so much that led her into severe depression and even PTSD. During the infusion session, she had the amazing experience of being like by a river and on the shore and just watching the river. And as the waters went by, she saw a boat coming, and her father was on this boat. And he mentioned to her some of the words, some of the things, and that at first, I mean, it was a very powerful experience, and she was so overwhelmed by the experience that she could not put together what he was telling her. During the integration session, I had her to write down, you can make use of anything, and exactly what was said. And she was crying. It was still difficult, but you see how we come into end, and I was validating her feelings. And this went on for like the whole entire hour. And she was finally able to remember key things that he had told her during that psychedelic experience. And then that's not still sufficient. So what I did, I was able to connect this with some of her views of herself, what it meant for her depression. And to be quite honest, the result in the session was just like incredible, like the insights that she got and how I was able to shift the way that she viewed herself from I'm damaged, I'm an awful person, I am worthless, really had those like feelings to gain a new meaning of herself and realize and form a whole new view of self to I can change my life. I no longer need to be going to have those feelings, to see myself this way. So it was a very, very powerful experience. And this was during the second session of infusion. Okay, so this is what is really being integrated. Now, what happened if she finished, she went to this amazing experience, it will still be powerful for her, but she was not going to be able by herself to sit down, write all the insights, so we start to remember the conversation and what was said, and finally to connect with her view of herself and some of the other deeper things, the meaning in her own life. So I hope this help, this example help of what really integration is.
Yeah, no, that's a beautiful story. Thank you.
Mhm.
Anything else that you'd like to share before we turn it over to Dr. Thompson?
So I just want to mention a couple of things is like to always remember that the therapist plays a very, very important role, as important as the infusion itself. Both are what is need to be put together to help someone with depression. In addition to just not just in addition to interpreting, making connections, is very important for the therapist to create a safe and supportive environment for the individual. Like she came to me and I was able to provide all the safety for her to discuss and to really put her emotions there on the table, to explore further all the psychedelic experiences. You're going to be amazed. Even when the individual says nothing happened, it's not uncommon for some of the sessions for them to say nothing happened. And then you begin talking and talking, and then you discover it is through the conversation that new insights will emerge. It's a conversation between the patient or the client and the therapist that will help. The therapist will help the individual, is going to provide emotional support, as I did in her case. The psychotherapist is going to develop coping strategies. Now, this is very, very important. Integration is not just like interpret what was happening and okay, goodbye. No, is how are you going to cope from now on? What are you going to do with your life? You give them the tools to move on and apply in the future. Hopefully, like a year later, 2 years later, 3 years later, they're still going to be using the tools. And finally, to set, and this is very, very important, it happens in the very last session, to set their intentions. What do you want to do with all those experiences? So those are a few things I would like to call attention about integration.
Well, thank you, Dr. Figueiredo.
Very, very welcome.
So, Dr. Thompson, can you help us just see behind the scenes of what actually happens in an integration session and what makes it different from just your standard therapy?
It's a great question. It's actually one that I think of on often from time to time. Like, how is this different? And I'm going to give you, for any DBTers out there, you're going to love my answer. It's both the same and different all at the same time. So it's similar in that we're using the same tools. We're therapists. I'm a trained psychologist. That's my tool bag. I'm working to apply these skills specifically in the context of a psychedelic or a pseudo hallucinogenic experience. So in that way, it's generally routinely different than in terms of what we may be doing in traditional psychotherapy, where that's not part of the content that may come up. And so for some people that may sound scary. And if you haven't had a lot of experience yourself or with working with others with maybe bizarre or unusual or psychotic thought content that just kind of sounds bizarre, it can feel scary. To me, this doesn't feel scary at all. I'm actually excited in that I know it's being stimulated in part by a variety of things, but at least in part by two things. One, their motivation, and two, from a drug that's been safely administered to them and that they're likely having some degree of a positive experience alongside it. It doesn't mean that their experience is always beautiful and pleasant, but some aspect of the ketamine infusion, for all the folks that I talk to, generally find some element of it fascinating, enjoyable, and calming, right? So these are great things. These are a great foundation to build on in therapy. So I know that the ketamine, if it's doing its job, is helping this person's mind, their body, getting into a place where they're going to be able to start moving more flexibly and from a less guarded posture. And so, I guess when we're conceptualizing the work of the therapy, what's really happening is we're working to maximize growth during this critical period, like we would think of developmentally, critical periods for language or whatnot, or really think of this infusion time as a critical period for this person, for their brain to open to new possibilities and be willing to explore them. So that's the way I think in which it's highly different from potential other traditional techniques or tools and to what we're applying it into. In my opinion, in its purest sort of form. And now this is where you're gonna really kind of start to experience how I conceptualize it, and the other modalities I use. You're gonna start to hear that being infused within. Nevertheless, so in its pure form, I conceptualize ketamine assisted psychotherapy as being client-centered. It's mainly non-directive and it's highly experiential. The main goal really being to enter that space with them and matching and collaborating in that exploration in support of that exploration. I'm not an all-knowing person. I don't think that's a good way to enter the space really with any client, definitely not in this scenario. So really moving into that space. As Dr. Anderson and Helmer have shared with us, the richness of content and how rapid the content from folks to share can be quite large and really rapid. So it can become emotional, spiritual, creative, a depth of historical content of their experience that can be engendered really rapidly, and they may be in a space to share it, which is the beauty of this process and helping them to work through their different difficulties. You experience an increased social connection and willingness. At least that's my observation. I frequently observe that in folks who are going through the infusion process. When they come in, there is an increased willingness, openness, a little less skepticism than perhaps prior to the infusion towards being with others or connecting, feeling safe within that space. So I also see a big role of ours as being, twofold in this realm, helping to tap into that experience within the moment, within this interpersonal moment in this therapy hour, and then also working to extend that beyond into the world outside of this therapy hour and outside of their ketamine infusion. Okay, so all the tools of all the other modalities are definitely at your disposal. You definitely will likely want to need them and may want to draw upon them. I frequently do that. And so all the sessions aren't necessarily just about integrating the experience during the infusion. For some people, that may be the bulk. But for all of them, at some point, you're likely moving more increasingly into the present and increasingly into like a change orientation or acceptance orientation, whatever that might be for their life and how they're going to move forward from this. The ketamine infusion itself is generally about 6 sessions. And so the integration part is very short-term and time limited. Now, therapy can extend beyond that, and it often does. At that point, it's no longer ketamine assisted, and it's probably going to start to move more into traditional psychotherapy modalities and really working to continue to build upon that progress that was initially made, and then anchoring it more and more into the present moment, into their recovery. Oh, this is where I really want to mention this. So just wanting to highlight that what I see as a priorities for us is to explore that psychedelic memory that they just had to the extent that they are able to really try to help our clients experience and deepen into the antidepressant impact from said ketamine, and attempting to understand and empower that within themselves in their current view of self. You got any questions for me, Bailey?
I do have questions for you. So I was thinking about, we have a ketamine consultation group, and one of the ways that we've described these therapy sessions as being different from your typical therapy is that it feels like therapy on steroids, which I think I actually said that to Dr. Anderson, and she's like, well, it's therapy on ketamine, but it feels like so much more happens so much more quickly. And so why do you think that is? Why does it feel like we just pack so much in such a short period of time?
The ketamine is helping folks to get out of their way. It's helping us to, I think it just helps us to lower our defenses, those anxieties, those worries we may be chronically holding knowingly, or perhaps in other ways not knowing, but it's allowing that to dampen, and then just allowing our greater self-exploration and our openness to change. So those things that before infusion, where we just thought weren't possible, like clear roadblocks, no-goes, can't do's, well, that starts to get a lot more flexible. And people may not be ready for that change or want that, but they're willing to approach it well, that's part of therapy too, right? Like we're helping, willing to approach those things. And so I think people are just in a space, a mood in their mind, their brain. The ketamine is doing its work and really helping people to be more flexible and open to potential new avenues. So I think that's what it is. And then Dr. Anderson could obviously speak to this too, like something within that social connection and willingness that I'm observing in, however that gets engendered by the ketamine or helps to get brought up, if you will. I think that's another critical piece. People are feeling more safe and willing to take those risks with you when they may have had a lot of stumbling blocks along the way in their recovery so far.
Yeah, I do think that's an important piece of the puzzle. In my experience doing the ketamine integration sessions, it kind of felt like on day one, you're starting where you usually are in a typical therapy relationship on like session 5. Like it just feels like the barriers are lifted. There's a lot of openness. There's a lot of willingness. But I think that's why it's important to have somebody like you, like Dr. Figueiredo in the mix, is because for some people that can be pretty disconcerting to feel just like super open. I don't know what to do with this. And you all can step in and say, well, I do, we're going to figure this out together.
Most definitely. I think for some folks, to have their CAP therapist may possibly be separate from whomever their ongoing was, might be powerful in that way. Actually, maybe a decision point for them too. Like maybe I may actually be more open with a completely unbiased person I haven't met before than somebody ongoing. Now that's a personal choice for everybody. Nevertheless, a lot of the folks, they come, they've been treatment engaged, they haven't had the success perhaps that they've wanted. And so they're coming with a desire for it, and they're motivated and they use it.
Okay. Well, before we open it up for questions, which we will in just a moment. So for those of us on here who are therapists, I know we have a lot of therapists in the audience. Can you explain a little bit about if somebody decides that they want to undergo ketamine infusions and they already have a therapist, would they continue going to that therapist? Would they temporarily come see someone like you all? Are both an option? How might that work?
Charlotte, yeah, do you want me to take it?
Go for it.
I think it's a personal choice. What's your rapport with your therapist? Is your therapist open to this modality? Do they know anything about it, and how comfortable are they with it? I think that would help determine a lot. So though we're utilizing similar techniques, if a therapist doesn't know anything about ketamine, doesn't feel comfortable with it, that's not going to be a great fit. If your client's not able to come in and ask you random questions about ketamine, and you can't provide some ongoing psychoeducation, which is also how it's different from traditional psychotherapy, because that piece is sort of always there as well. You're helping folks to understand what's going on, the context of ketamine, the context of their life, and trying to help them organize that and make sense of that. I kind of, so that's key.
Yeah, so the times when you have had somebody come to work with you, or Dr. Figueiredo, feel free to answer too, that's had an outside therapist, practically what does that look like?
I'll go real quick and then Helmer can pop in. It's been different. For some folks, it is very time limited, and I'm seeing them for ketamine assisted therapy integration, and we're done at the last ketamine infusion. So after that, so it's very quick and tight, time limited. I understand what their goals are, high focus on the integration of those experiences, and then moving it into next steps of their lives. For folks that I may see ongoing, like perhaps I've already been seeing them, they then decide to move into ketamine assisted psychotherapy. That can happen really, all these ways can happen really seamlessly, but I can actually in that moment set the stage for them, help them to build that understanding, in that, continuity of care. And then we can just sort of move straight into that. Continuing along it's not that all of a sudden the skills and the techniques you're using are grossly different, but their ability to perhaps grasp them, to deepen around them, is going to be different, hopefully.
Okay.
Yeah.
Yeah, and just a few words I want to remind is there are also, when we talk about this type of therapy, number one is that we have to remember that those are individuals that come to us, and when they go for ketamine, they have already, in most cases, failed other treatments, like using the SSRIs, for example, you know. So these are individuals who are going to come very, very depressed, and boom, ketamine, in quite a few studies shows that will lift that depression very quickly. Point that some individuals session and they would tell you like, I'm feeling different already. I don't feel like I have, so this is very different from the typical psychotherapy. The patients are going to have the drastic change in their presenting problem, in their symptomatology, so you're going to see somebody who's going to be on a change, in a very, very quick change. The other thing is like when we typically do a therapy, let's say if we do a cognitive behavioral therapy or if we do interpersonal psychotherapy for depression, any kind of be a protocol or not, we still have an agenda. We still like driving the therapy. In this type of a therapy, it is the patient, it's their experiences is really what is going to drive the therapy. And this is one of the reasons why there has not been one specific modality yet. And I'm sure future studies are going to show, we'll begin comparing, so far, studies, for example, by Wilkinson, the one they published like in 2017 with his group, and another one they published in 2021 is using CBT. But ketamine is also using other uh, conditions, like besides like major depressive disorder, like obsessive compulsive disorder, post-traumatic stress disorder, alcohol use disorder, opioid use disorder, and they have used the CBT, they have used mindful based interventions, motivational enhancement therapy, existential oriental therapy. So you have the open room, but you have to remember that the leading factor here is the patient experience that is taking place into the room in the place, like in Dr. Anderson's clinic when the patient is there. So those are one of the things that you find different from the typical therapy when you see a patient therapy.
I just want to add one thing to what you said, Helmer. Like, yes, we observe this like very acute calming effect. We don't see them the day they've had their infusion. No one's high with us when they come in, but that calming effect is still there. And when you sometimes see that in the traditional world, if you will, perhaps everything else is dampened. That's not the case with ketamine. This fascination and creativity is still there and alive and well. And so they're more calm, but they're willing to go there. And they're fascinated with it. They want to approach it.
Exactly.
It's just lovely.
And this so quick, for example, I won't go into the details, but they studied by Wilkinson, like the 2017 study, which was their first study. They had and that was the first like open label, it was an open label trial. Their second study was a randomized controlled trial, the one in 2021. But in that study, they had a total of 16 participants, and 8, they responded really well, very quickly. 50% of those initial participants, the 8, they responded to the ketamine infusion. 7 of this, the remission happened, 4 patients, the remission happened immediately after the first infusion. So that's impressive, and then 2, it was 2 other patients, it was after the second infusion, and then there was 1 after the 4th infusion. And those are for 50% or 8 of the 16 patients. So this is how to show you, to illustrate how fast the changes will take place in the individual's life, And I could also talk about the 2021 studies in which they had a far, far larger number of participants, which was like about 42 participants, and 28 of those participants, they had a remission of depression, complete remission at the end of the very last ketamine session. That's in the paper, and that was 66.7% of those patients in a very protracted time.
So I'm aware that we're getting a little bit tight on time. We'll stop the recording in just a moment. I just wanted to thank Dr. Figueiredo, Dr. Thompson, Dr. Anderson for all of your time and brilliance.